Afternoon. Good afternoon, everyone. We're so happy to see you all back to today's session organized by VODAN Africa and Asia. My name is Mariam Basaja, a PhD at Leiden University, and also the training of trainers take support VODAN Africa. So on our agenda today, as always, kindly mute your mic during the presentation to prevent background noises. And if you have any questions while the presentation is going on, please type them into the chat box and we'll bring them up after the presentations are done. We'll also have a question and answer session at the end of the session. So I think I'll now hand the floor over to Professor Francisca. Well, seeing as Professor Miriam is not yet, has not yet joined us. So Professor Francisca, the floor is all yours.
Yes, thank you, Mariam, and a very good afternoon to every member of our community who is able to join us today. I would like to welcome you to our usual weekly Tuesday meeting, and thank you very much, Mariam, Aliyah, and Putu for hosting today's event. I would like to especially welcome the Vice Chancellor, Professor Mpeza, who is also joining us today. Professor Mpeza is the chair of the VODAN Africa Board. And to welcome Beth and Eric Flickensheld and of course Dr. Dejan. Yes, VC, if you'd like to just say a word of greetings to the VODAN Africa team.
Yes. Thank you so much. Today I'm privileged to have gotten some little time, so I'll be waiting to listen in. But otherwise, we thank everyone for their participation, especially those that are coming on board to guide technically. Thank you so much. Enjoy the meeting.
Yes, thank you, VC.
Oh, we're very happy to have you, VC.
Thank you so much, Mariam.
Yes, thank you, VC.
Go on, Francisca.
Yes, thank you, Mariam. I'm going to have to hand over back to you now to take us through the agenda. I think the first presentation will be from Putu on the update of health facilities communication. Putu?
Yes, Prof. Okay, I will update about yesterday's discussion. There is not so much discussion yesterday because we already discussed about the dashboard requirement or the dashboard requirement topic list to communicate with the health facilities. So right now, the decision is to remove the COVID-19 questions on the question topic list, and Dr. Reginald will explain why in the on the next agenda. But yesterday we discussed to focus. We are discussing about the interoperability identification. It should be in the 3 health facilities. And the next discussion is about we are starting to check who's the person that can be talked from the health facilities, or we can discuss with them or with the person in the health facilities about the dashboard requirement. And we are starting now with the 3 health facilities. It is KIU from Uganda, Camry from Kenya, and the last one is IBBUL from Nigeria. So that's all from my side, because right now we are consolidating the discussion with the health facilities for the dashboard requirement. So and for the report, for the general overview, or Professor Miriam call it a passport for each health facilities. So I will prioritize the pilot. So it's from Kenya and also from Uganda, and I will do the final report for IBBUL, and next week we will discuss about the content of the passport. So we want to finalize the passport before we finalize all of the 84 health facilities. So that's all for me, Professor Francisca and Mariam. Back to you, Mariam.
Thank you for the update, Putu. Well, I think we'll now go to the next session of the agenda, which is update from Aliyah on the templates and vocabularies. Aliyah, the floor is yours now.
Thank you very much, Mariam. So I don't have much update on the templates and vocabularies this week. So I'll probably skip to the next part, testing in CEDAR Stanford. So this is the task that I focused this week. So let me share my screen. Just a second. So basically, last week I have shown them the query that has been sent in order to obtain some data from the certain template. So this week it's basically gathering information from different resources. So as an example, so there are 2 Ethiopian metadata instances and also 3 Ugandan and 3 Tanzanian. So in total, there are 8 metadata instances that has been generated from the templates from Uganda, Ethiopia, and Tanzania. So the idea to get access to those contents, I mean, like metadata template instances, and then from that, to see the content. So basically, this is the content. So with the different rows and columns. So these are all the columns given from the 3 templates, basically. And these are the template instances themselves. And in here, for instance, we can obtain basically any data that we need. For instance, if we got the column names like financial year or date of admission, patient address, so we basically then obtain like any information. So from that we can also make summaries, number of patients, also number of visits per day, per month, and etc. Splitted by the templates, by the country. So basically this is just to check how theoretically it works. So the feasibility of the query, sending query to and obtaining data from several templates. So that's basically it from my side.
Oh, thank you, Aliyah, for the detailed updates. We'll now go next to All Zahas on the CEDAR deployment. All Zahas, the floor is yours now.
Thank you. Yes, regarding the CEDAR deployment part, we actually we had able to run all the services. Only thing that we couldn't see the user interface in order to be able to register user in the local point. So we had some problem. We directed this question yesterday to the John Grable, so received answer to that. I couldn't able to check that answers yet, so I hope today or tomorrow I will be able to check them. Yeah, check the feedback from the John how to solve this problem. Then we are planning to make like same query as Aliyah did, the local point.
Okay. Thank you for the update, all Zaz.
Thank you.
Maybe we can have an update on the dashboards. Maybe Eileen or Ridwan. Oh, Ridwan is not on the call, so maybe Eileen.
Mariam, I think Yilin and Oluwale are working on the dashboard, but their work is a bit stalled now because they are waiting for the output from the group of Putu. Since we know that the dashboard in most cases will be dependent on the agreement with the countries and of course the management of the health facilities on what kind of information they would like to see on the dashboard. We have the generic, like the general VODAN Africa dashboard that contains information about the health facilities and their location. But then the specific health facility individual dashboards would depend on the work of Putu on what analytics the health facilities or the ministries of health or the government would like to see. So I think that is one. They already have the structure ready and they have the back office and the backbone developed and demonstrated here and to the steering committee last month. So that is the update I have on that. I also have an additional update on the CEDAR deployment. You will recall that VODAN already successfully deployed for Europe for the LUMC. So I had a brief meeting with Professor Miriam earlier today, and she's almost getting the server, the LUMC server for VODAN Africa CEDAR deployment for the LUMC. She gave me that update. So what we're taking to the country coordinators meeting now, following the success recorded by the group of OXAS, especially by Nambobi, we will be able to estimate the hardware requirements for each of the health facilities and then start the process of the procurement of the computers and every other thing that will be needed, because we were actually waiting for one successful deployment in Africa. We already have that of Europe, but then we look at it that the technical specifications will not be the same. Europe has better internet, for example, and then several other factors. But for Africa, we wanted one single, at least a single successful deployment, which Nambobi has been able to do, not minding some of the services that are not running, but taking into account all the services now, we can estimate the size of the hard drive, the memory requirement. And I know the team of Gejan has something on the backup, a proposition on the backup. So we're going to be able to put that together and then have a meeting of the country coordinators by Dr. Reginald, and she'll be able to come up with a requirement that will serve across the 84 health facilities. So that's by way of updates on the deployment at the administrative level, and then of course the dashboard. Thank you, Mariam.
Oh, thank you for the detailed updates, Professor Francesca. Well, next on the agenda is an update on the component input into the DHIS2. I don't know if Nurula is on the call. I can give an update on this. So basically what has successfully been done so far, an algorithm has been successfully created, and it takes all the metadata created based on a given template and sends the data into the DHIS2 demo system, which we are currently using. However, the current concern and limitation is the authorization because of the fact that each facility has a different CEDAR account and a different DHIS2 account, and the algorithm basically needs to access the data and handle the data flow. Well, we've had a few solutions given by John, during one of the meetings, and that is to probably use an API key that would strengthen the security of the API, and then the other option would also be having a service that is specifically getting the data from the hospital internal system into the DHIS2, so that there is no direct contact between the DHIS2 and the internal system, as well as the CEDAR system. So that is the current state of art. It's still a work in progress. And yeah, that is basically it from the component input into the DHIS2. Well, the next item on the agenda is an update.
Mariam, can I ask something?
Yes, sure.
Yeah, about the interoperability about your work and Nurullah, because right now we are identify the system of the current health facilities that not using the HIS, and also how's the chance of the interoperability. So what kind of information you needed beside the format, and also the information, the health information system that used in the health facilities? Are my question, are these questions enough? Do you remember the question?
You asked whether the data, like the kind of data that is required for the algorithm, or?
Wait a minute. I will share my I will share my screen. Just like I discussed, just like I told you yesterday.
Mm-hmm.
So these two questions want to know about the interoperability of the system. The first question I asked about the procedure of the if the current system can share to the other system, and the second one is about the format. So do you think you need another question to ask to the health facilities?
Well, not at the moment, because right now we're basically trying to figure out how to pass the metadata on from the CEDAR system into the DHIS2. So
yeah. So
yeah.
I will give you the result after I collect all of the answer.
Oh,
then
yeah.
we can think about that later, to consider the health facilities that not using the HIS2, that
yes.
only using the HIS2.
Yeah, that will actually be relevant for the visualization parts for the facilities. So it will actually be great if you share that information. Thank you.
Okay.
Yeah. So next on the agenda is the updates on the components or procedure for the backup of the data.
Yes, greetings. I was asked to facilitate that discussion. We did it a couple of months ago, and that discussion has been materialized in a discussion paper explaining all the different ways of backing up, whether off-site or on-site, and what the advantages and disadvantages are, and a proposal to incorporate cron jobs with backups, physical backups to portable hard disks running around for once a week, overwriting every week, and once a month, and put them in several safe locations at the facility. And of course, encrypted backups. That paper is now being shared, I think. So we look forward to discussions with those who see in the various part of the architecture where backups should be implemented. So there is something to discuss, and I look forward to those discussions.
Oh, thank you for the update, Keshan. That was very insightful. I don't know if anyone has any questions for Ketan. I guess not. Okay, so next we'll have an update of the country coordinators meeting by Dr. Reginald. Dr. Reginald, the floor is all yours now.
Yeah, thank you very much, Mariam, and thank you everybody else for the presentations. As country coordinators, we had a question to deliberate on last week. We had an impromptu meeting to answer this question from Professor Miriam van Reysen. And the question was, that was raised from the steering committee, whether COVID data should appear on health facility dashboards. What do country coordinators think? And the conclusion after deliberation from all the country coordinators present was that should not be included for now, as treated as sensitive data, very confidential, and each country has policies on handling this kind of data. So for now, we may not include it. That's all from the country coordinators, and we are going to meet tomorrow again at Central Europe, 16 hours. Thank you.
Thank you, Dr. Reginald. Next on the agenda, we'll have an update on the special issue by Misha. Misha, the floor is all yours now.
Hey, can you hear me?
Yes, we can hear you clearly.
Fantastic. As most of you might have seen, I have sent all the reviews have come back from both authors. So I have sent them all to the listed author for communication with the reviews and of both reviewers. So you should have two reviews, one document by Professor van Reysen who edited it, and a fourth document, which is an edited version of the document by one reviewer. Please take as much into account as possible, especially the comments made by Professor van Reysen. So the process is almost done, and I have received several articles back already as well, which is very good. Try and finish them as soon as possible and send them to me. We are going to do a plagiarism check on them before uploading them to the server, and then the articles will be ready for publication. So if everyone can try and finish it by the end of the week, that would be fantastic. If that's not possible, please send me an email, and then with an estimation on when you think you can finish the article by, so that we know and that we can plan around it. But try and make it as fast as possible. A second thing is I'm going to send you all an email, or I'm going to send all the corresponding authors an email about final author information, acknowledgement, contribution, authors, and so on. I'll send that out tonight or after the meeting. So that should that should be all the final information without any changes afterwards. Yeah, I think that's all from my part. If there are any questions.
Does anyone have any questions for Misha?
No? Fantastic. Don't hesitate to send me an email either if something needs to be clarified.
Well, I think Dr. Sakinat had a question for you. I don't know if she managed to reach out to you.
Yeah, I've spoken to Professor Sakinat this morning.
Okay, all right, perfect. I can see Professor Miriam van Reysen joined the meeting. Miriam, in case you have anything to add, the floor is all yours.
Well, nice to see you, Chair Mariam. No, I have nothing to add. I put it in the chat that this server is really being, it will be available any day now for Olshas and Rudwan. And only addition on the special issue is that our volume will be volume 4. So it can already be, if you are using it here or there, you can, you know that it will be as volume 4. The one thing that we still need to do is the final cross-referencing of all the paper. And we are working on the overview, article number 1. And Putu has started to have a core ingredient for that, and now we are building on that. So hopefully we'll have that done by the end of this week. That's all. Thanks. Sorry, I was a little late. Sorry.
All right. Thank you, Prof. Well, next on the agenda is questions and any other business. If anyone has any questions, feel free to ask now. Well, I guess I'll close our meeting now. Thank you once again for joining the meeting, and see you all next week.
Thank you, Mariam.
Thank you, Miriam.